Thank you for making this happen, sir. I mean, without you, we couldn't have made this happen here in JSS Medical College. You were a great support from the beginning. From the beginning that I told you about the vision, why EliteMed is doing the workshop for the students, and from there I could see that your support was there, and thank you so much for that, sir. So, can you please tell me about? You can introduce yourself.
Yeah. Hi, Profula. As you know, I'm Dr. Vikram Patil. I'm Associate Professor in Radiology, and also I'm the Deputy Dean of Research of the university. So, when you approached me through for this intervention radiology event, it gave a lot of meaning to me, because radiology is evolving a lot, and intervention is an integral component of every way of life in radiology nowadays. Earlier, you were aware, we used to call it MD radio diagnosis, but now we have been trying to change that name to make it into radiology and intervention. So intervention is an integral component of radiology, and your EliteMed through Dr. Uttappa and his team are making a great difference to whatever efforts the Indian Radiology Association is also making in promoting intervention radiology and making it an integral component of radiology teaching. And thank you for making this event happen.
Yes, sir. Sir, so as a radiologist, what's your perspective on role of interventional radiology in broader field of radiology, and how do two complement each other? What do you, in your perspective?
Yes. So, as I was trying to tell you earlier as well, that radiology is no longer a diagnostic field; it's a therapeutic field as well. So, as we discuss now, we see a lot of minimally invasive procedures gaining a significance compared to your regular procedures. So, intervention radiology has changed the patient care a lot. So, we are now in a field of area where we are doing all minimally invasive procedures, daycare procedure, painless procedures, and all that is again thanks to intervention radiology. So intervention radiology is definitely playing a huge role, and it keeps updating and innovating. As we see today, we are seeing radiofrequency ablation as a therapy for tumors. We are seeing embolization as a therapy for tumors. So there is a significant leap in the way treatment is changing across the spectrum, from medicine to surgery to all kind, even obstetric and gynecology. So I would say intervention radiology has made a huge impact already in the field, and it's going to improve henceforth even more.
Okay, sir. Sir, so like from what we have spoke to the medical students, we got to know that they don't get an exposure to this particular specialty, like interventional radiology, even during their internship time. So what's your thought about that? How can we like workshops like this, or should we do more workshops like this, or should we take it to their curriculum itself to make them understand? Because it's during the internship time, that a medical student will be thinking about which specialty to go in. So when we talk to a broader medical students, we understand that not many has an interest in interventional radiology, or not many know about interventional radiology. So you being in a medical college, and you interact with medical students on a daily basis. So what's your thought about that?
Yes, as you absolutely said, the students will not know about this specialty unless they're introduced to this specialty. So we have to definitely make sure that such workshops are done on a more regular and a frequent basis, so the awareness is created about this option being available. Especially as I was trying to enforce earlier also, it's the minimal and daycare procedures which can make a huge difference. Now if you would have operated for a fibroid surgery, probably would have taken 4 days or 5 days in the hospital stay. Here you can do it as a daycare surgery. So there are a lot of such scope which is happening, and workshops will make a huge difference for their understanding and knowing up the avenues that are available for them in the field of radiology or intervention or any therapy for that matter. Definitely I would encourage you to take it to as many places as possible and reach out to as many medical students as possible. Although NMC has also introduced a small component of radiology teaching into MBBS curriculum. Earlier we did not have any single theory class. Now we have around 15 to 20 theory classes. In that, one small module of intervention has also been introduced. But I think such workshops which give a hands-on feel and visual impression will make a huge difference for them to take it forward as a career in their lives.
Okay, thank you so much, sir. So before wrapping up, you can tell me what's your suggestions on the workshops, like, furthermore if you're conducting, and how did it go, how did you feel about it, and your words would be of more value to us on our furthermore workshops, sir.
Yeah, this I would say is a commendable job that you have done along with your team and Dr. Vipin Uttappa and the other intervention radiologists you could bring to JSS. It was a very good beginning, I would say, because all our students have been exposed to such RFA and such procedures for the first time. Although we have been doing a lot of hands-on for the other procedures, but there are, especially the vascular intervention and RFA was very good, I would say, for our students. And this has been conducted very well in a very organized manner, and I congratulate you and your team for that, and wish you best of luck to make sure it happens in many places and make intervention radiology a happening thing for the future. All the best for you.
Okay, thank you so much, sir.
Yeah.